Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
In pathological gynecomastia, the drugs which are causing pathological gynecomastia. So, drugs causing pathological gynecomastia. Number one, we have drugs which are estrogen related drugs. Estrogen related drugs, obviously there is increased estrogen. These are related to estrogen, so obviously there will be pathological gynecomastia. These are diethyl silvesterol, OCPs, oral contraceptive pills, or digitalis. These are estrogen related drugs which cause pathological gynecomastia. Then we have drugs which are enhancing the endogenous estrogen production. Estrogen formation was increased by the following drugs, like gonadotropins will increase the estrogen production. Similarly, clomiphene citrate will also increase the estrogen production. Then we have drugs which inhibit testosterone synthesis and axis. The drugs which inhibit the testosterone synthesis and action. Drugs which inhibit testosterone synthesis and action include, we have metronidazole, alkylating agents, cimetidine, cisplatin, ketoconazole, spironolactone, flutamide. So these drugs will inhibit the synthesis of estrogen and the action of estrogen. Then we have unknown metabolism. Unknown metabolism resulting in synthesis of unknown mechanisms which are responsible for gynecomastia include captopril, calcium channel blockers, busulfan, isoniazid, penicillamine, methyl dopa, tricyclic antidepressants. All these also produce estrogen excess by unknown mechanism. All these can also result in increased estrogen, not estrogen excess production. Actually, they will cause pathological gynecomastia.
thank you and thank you for watching.